supported full arch restorations. Usually, if patients are breaking their provisionals, it's really diagnostic and shows that they do have possibly some occlusal problems, or maybe the design of the prosthesis just isn't correct. And so a lot of times it's just the patients, when they haven't had teeth and they got a whole new arch full of teeth, it takes them a little while to adapt. And the quick splint can, be useful to protect these prostheses, but also to relax the muscles. And so you can develop a good, stable occlusal position. And so once you've got a good stable occlusal position determined, then it really, if you have any failures, it's more a matter of just prosthesis design.
The All-on-X prosthesis is a unique beast. For most of the patients that need restorations like this, many times they're missing a lot of their posterior teeth. And we also know that it requires posterior teeth to be in contact to fully recruit the elevator muscles. Occlusion is nothing more than the science of force management. So once we give people all these teeth that they can bite and clench on, now they're going to get recruitment of those crusher killer elevator muscles. So the quick splint allows us to manage the forces by reducing the elevator muscle activity by up to 70% by just having the pressure on an anterior appliance. And this allows our patients to go through the provisional stage, the testing stage, without breaking their provisionals, which is a godsend for anyone who has a busy practice, that they don't have to have patients call at the last minute and fix them. So it's a wonderful tool to have in the toolbox.
Hi, Dr. Mike Smith from Biting Education and Clinical Mastery Series. So the question is, for all-on-4 cases, why do some patients break the temporaries? Well, you have to think about proprioceptive response. When you take all the teeth out and you put implants in and you put this bar, you put this overdenture, you put this restoration in place, they lose the feeling of where their jaw's supposed to be, on how they're supposed to connect, how they're supposed to occlude, how they're supposed to hit. Well, when they smash, crash, and bash, they can break things very easily because their jaw doesn't know where it's going. It hasn't trained itself. The muscles haven't trained. There's no neural response. So what the quick splint does for us in these temporaries is it keeps them from having that smash, crash, bash that can break the temporaries because they don't know where their jaw is going to be. It also helps to mitigate the inflammation of the joint response because you've done a lot to change their occlusion to rebuild it with those temporaries on those implants. So it really helps to calm things down, keep the muscles under control, and keep the joint from getting inflamed.